Hey, this is Rob Anspach, and today I'm interviewing Brandi Carter, who had her VSG surgery through Dr. Alvarez of Endobariatric. Welcome, Brandi.
Thank you for having me.
Now, kind of explain to the audience, the listeners, about your journey.
Well, just a brief, I've wanted to have VSG surgery for quite some time. Insurance never approved my surgery because I've never had health issues. So, occasionally people would post pictures on Facebook and things like that, and I would question, and it just made me more intrigued and interested in having the surgery. Um, Long story short, I lost my mother January 20th of this year to a massive heart attack. She never had heart problems or never had anything that would lead to that. So my doctor sent me a referral to our local hospital to have the surgery done. My insurance still denied. He referred me to Dr. Alvarez, and I recalled after questioning some people that they had used Dr. Alvarez as well. So I just started talking to Susan. My sister and I are really close, and she was interested in it as well. Mom had, a massive heart attack, and we shared the same primary doctor, and he said the only thing that he would think that would lead to her massive heart attack was she was morbidly obese, and she did have a lot of stress. And of course, I'm a cosmetologist, and I do deal with the public every day. So, I do work a high stress job. I have two children, husband, so I have the normal everyday life that I just, I am overweight. I was 399.4 pre-surgery. And it was something that I needed to do for me and for my children and my family for the longevity of my life. And Susan she warmed me up, and we had an instant connection when I started speaking with her. Every question I had, no matter how stupid or uncomfortable I felt, she just made me feel comfortable, and I've always felt at ease with everyone there at Endobariatric.
Was it scary at first, though? Thinking about the surgery or going somewhere outside of your state to have it done?
Honestly, that is something that everyone questioned me about. Why? Why would you go there? Why not just do it here? I never had questions about it. I think because I looked so long, for about 2 years into Dr. Alvarez, people were referring me. And I guess just watching their journey and knowing everything went smooth with them, it was just good for me. So I was never worried. Now my sister, on the other hand, we did it the same day. She was a little scared, and up until the week before, she was like, I don't know. But I think the comfort of knowing I was so at ease. I'm the big sister. So, I was so at ease. It helped her be at ease.
Now, it's been 6 months since your surgery. How has your life changed?
Oh, tremendously. I have more energy, of course. Um, the biggest thing that I notice is whenever people are eating, I know sounds crazy, but I almost get sick watching other people eat because they eat so fast. I tell my kids all the time, slow down. You don't have to eat that fast. Or the amount of food that they eat, is something to me. So that's something big for me, is the amount of food. It's very little. I figured by now I would be up to 5 ounces or so, but I'm still on the 2-3 ounce mark every time that I eat. I'm able to walk without passing out. I can walk a mile pretty quickly. Before, it would take me almost 30 minutes to walk a mile, and I think last week when I walked, I did it in 17 minutes or so. So, that's nice. I had bad knee trouble, bad back problems. I was going to the chiropractor 2 and 3 days a week, and now I go maybe once a month. So it's just, there's so much, of course, clothing size and, things like that. everything has changed for me, and it's all for the better.
What are what are some of your high points? You know, the things that you're starting to experience now for the very first time that you haven't for forever probably.
Um, it's little stuff. A lot of things that I noticed is like when I'm riding in a vehicle and I'm buckled in my seatbelt. Used to, I could not bend down to pick my purse up out of the floorboard if I was riding with someone else. I can reach down and pick my purse up and put it in my lap or get my phone out of my purse or whatever without having to unbuckle my seatbelt. I can sit in Indian style. I can cross my legs. I purchased my first pair of heels the other day. There's just so much. I mean, I should have been writing a diary on all this. I mean, there's just so much. Every day something else happens and I'm like, wow. It's a life-changing situation for sure.
How is your husband or kids reacting now to you losing the weight?
Well, to be honest with you, my oldest son, he's about to turn 17. He is 6'3", and he's about 300 pounds. He's about 15 pounds from 300. But he's very interested in the surgery as well. And of course, mom's telling him, I want to see you try your hardest first. I've been there, done that. And I would definitely, if I had the choice to do it earlier, I would do it, after I had him. Probably I had him when I was 19. So I wish I would have had it done a long time ago so I didn't have to deal with all the problems I had, as an overweight young adult. So I would love to be able to do that for him. I mean, he's an amazing child and I think the world of him, but I'm going to make him work his booty off to do it first by himself. My youngest son is 6. And he first told me that he couldn't tell I'd lost any weight. And when I showed him my before and after picture, wow, he's like, I can't believe it, Mom. He's like, you look so good. And yesterday I went to do my photo shoot and both kids told me I was so pretty. That made me feel real good. And my husband, of course, he's always been 100% supportive. But I have made him a little bit more conscious about, what he eats and things like that. So I think all around, I'm probably going to get a healthier family.
Now, tell me about your experience with Dr. Alvarez and Susan, his coordinator. I think that you've become very good friends with Susan over the last 6 months. So, just to kind of, share your thoughts with the audience of the experience from start to finish, from your surgery to the phone calls to everything.
Oh, wow. There's so much I could say. There's such a blessing. And beyond just my surgery, just in general, I don't know. I could get so emotional about this. Susan has just been A1 top notch. I could call her about anything, not even surgery related. And she's just so good at not ever, I guess I always felt like I'm probably on this lady's nerves. She's probably at the point where she's like, you're going to have to call somebody else because I can't deal anymore. But she's always been there for me and she's always answered all my questions. Anytime I post on social media, every Wednesday I post a, weigh-in Wednesday. And both her and Dr. Alvarez are so supportive of me. And I can't even begin to say, if I would have had that surgery here, or even if I would have done any kind of program here, your doctors or surgeons or nurses, they're not so personable about that. And this is a big lifetime change for people. This is not just, something that's just going to happen overnight and then you don't have nothing to deal with forever. It's been 6 months and every Wednesday, Dr. Alvarez comments on my post every Wednesday. And sometimes I post in between on Instagram. I will post the food that I eat and occasionally he'll comment. It just feels so good to know that he has so many patients, but yet he continues to remember me, and not just me. I can go through anybody's post that tags him or Susan and they comment to him. That's so amazing. There's just not good people like that. And his bedside manner during, throughout the surgery situation, he was so good. I had a piece of paper. He probably rolled his eyes when he walked out the door, but I had a piece of paper with questions, and it was a 2-page questionnaire. And he just sat and answered them all with me. And it was just like, he wasn't weird. He was just like me, he talked to me and conversated like he was just a normal person. It was awesome. He's an amazing person, and so is Susan.
So you've kind of grown attached to the social media, the learning aspect of it.
Absolutely. I think that everybody in this whole VSG situation, I think that we all have to, we all have to be a family. I call Endobariatric my endo family. And I think that we all have to stay supportive of each other and, show each other our support and help the next person, when they get discouraged. Everybody has stalls, and everybody, goes through a point where they may gain a pound or two. It's normal. But, so many people get upset and, that kind of thing. And I just, I always try to be there and support somebody. If I've been through the situation, I want to help them get through theirs, because it's not easy when you feel like you're alone.
Let's talk about, plateaus. We all go through them. How do you overcome some of those?
Well, it may not be Dr. Alvarez's way, but this is my way. Honestly, if I plateau for more than 2 days, I will bake a cake, or I will do something to that sort. And it's usually a strawberry cake because it's my favorite. And I have a big heaping tablespoon of strawberry cake and a heaping tablespoon of frozen yogurt. And I eat that. And honestly, it just throws my body in shock or something. I don't know. But I usually get right past it. So, but I know that we're going to go up, and we're, us women, of course, we have Mother Nature that comes along. And during that time, I can always tell my weight fluctuates too. So it's just kind of one of those things that you just have to be patient and push on through. Something different works for everybody, but that's usually what works for me, is to throw my body in shock. And if I don't eat cake, I usually eat something like chips and dip, or I'm not a pizza fan at all. I still can't really. I've tried to eat the toppings off pizza, and I still just can't do that. They just don't work for me. So it's usually chips and dip, or cake and frozen yogurt.
Now, do you tell friends that you've had the VSG, the gastric sleeve surgery, when they see you when they haven't seen you for a while, and now you're thinner, and they're like, wow, how did you do that?
I'm very open about it. If I can help somebody else, this is definitely what I want to do. So I'm very open. When I decided I was going to do the surgery, I did post it on my Facebook and Instagram. And I actually made myself a separate Instagram page because of the fact that I have done every diet, every program here in this town you can think of. And I know people got tired of seeing that over the past 4 years. So I made myself a separate Instagram account for, because I do work with the public. So I have quite a bit of friends on Facebook. So I made something a little bit different so that people that was interested could watch. And now I probably have 1,500 followers, and it's only been 6 months. You know what I'm saying? So I'm very helpful and supportive, and I love to help the next person. So yes, when people ask me, I'm all about telling them what happened. And every 6 weeks or so, other stylists in the salon, their clients will come in and they're like, wow, where are you at now? And I'll tell them, and, you know, they're so excited for me. I mean, it's just awesome to have such a supportive group. And there's several clients that come to the shop that has used Dr. Alvarez. So it's nice to have other endo family, you know, in the salon. So it's nice.
Now, do you take selfies of yourself and compare them?
Absolutely. Um, that's, you know, I can't see what other people see. People tell me all the time, you look amazing, you know, I can't get over how thin you are, you know. And I'm like, no, I just don't see it yet. It's like when I see myself in the mirror, I kind of see, I can really tell my stomach has went down, but nothing like what they just, you know, they keep saying the word thin. I've never heard that, you know, or you're so skinny, or skinny mini. I've been called skinny mini a couple times, and I'm like, no, I don't see that. But if I put my before picture with my after picture, absolutely, I can tell a huge difference.
Now, you said at the very beginning you were about 400. What is your goal? I mean, where do you want to be?
I can't really tell you because I don't want to be thin. Okay. So I have always been athletic. I played volleyball and basketball through high school, and I do not want to be thin. I have my goal set at 199. I'm 312, and I just don't know that 199, it may be too thin for me. You know, I'm 5'11". Um, we'll see. We'll see. You know, my sister, she is a lot shorter than me, and she's probably about 40 or 50 pounds less than I am, but we're only one pant size apart. So, you know, it's kind of one of those things that my build is a lot different than others. So I haven't been 199 in forever. I don't know. So I guess as I get there, my goal may change a little bit, but 199 as of right now.
What what have you lost so far?
So far, I'm at 87.5.
Wow.
Yes, and of course, you know, January 2nd will be my 6 month. So I'm getting closer and closer every day.
Now, what advice would you give someone if they were thinking about getting the gastric sleeve?
Do it. I mean, you know, it's just kind of one of those things that I don't know. I mean, that's why I say with my son, more than anything, I tell people all the time that really question me if I have any regrets, or no, I don't. More than anything, like, the amount of food I eat now compared to what I used to is so amazing. And I just think that so many people in this world need that structure of not eating as much. And so, you know, that's why when I've told a handful of people I would love for my son to be able to have the surgery, and they're like, no, you can't do that to him. He's young, blah, blah, blah. And I'm like, no, you don't understand. Like, just even for the simple fact of the amount of food that he will eat after surgery, I'm so about it. I mean, it's such a difference in the way that I feel, the way that I can breathe, the way that I sleep. I mean, it's a blessing. And if anybody out there is wanting to have it done and questioning it, do it for your health and do it for your family, do it for your children. You know, I totally recommend it.
And do it so you can get back in high heels.
Yes, absolutely. Yes, I can't walk real good in them just yet, but hey, I have them.
Now, outside of the endobariatric world, you also participate in obesityhelp.com. You know,
Yes.
yeah, I guess you have a profile. How has that helped you?
Okay, so Obesity Help, when I first started, trying to understand surgery. I've had a couple people have the actual full bypass, and I've had several clients have the R&Y, and I just really did not understand why everyone chose something different. You know, if this is supposed to be the most successful and that kind of thing. I just wanted to understand. And they would explain their version of it, which they really didn't understand. Their insurance paid for theirs, and that's what the insurance would pay for, and that's just what they did. So for me, I wanted to fully understand it, and obesity helped me understand. And then on top of it, I was able to reach out to people that had surgery with Dr. Alvarez. Any questions that may have crossed my mind, you could get on there. There's so many questions and answers out there that I wouldn't even have to bother Susan with, because it was already out there, But Susan really helped me understand that everybody's journey is different, and that is so the truth. There's so many people with the endo family that will write me and say, blah, 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 blah. And I'm like, listen, your journey is going to be different than mine. I can tell you, what I experienced, but that does not mean that's what you're going to experience.
Let's talk about Mexico. Were you ever in Mexico before?
Never before, first time.
So when you got to, I guess, San Antonio, Rosie picked you up.
I actually was crazy, and I drove all the way to Eagle Pass, 19 hours.
Wow.
Yes. Actually, my brother-in-law drove me, so I was a backseat driver. So we drove to Eagle Pass, stayed the night. Rosie picked us up the next day, took us over the border. And of course, we wanted to be taking pictures, and she's like, not at the border. So we was like, all right, well, we get over the border, and everybody is like, Mexico is just a nasty place, blah, blah. No, there was nothing nasty about it. I did not have a bad experience. Nobody crossed me the wrong way. And to be honest with you, the day after I had surgery, I asked Dr. Alvarez, could he take my IV out and let me go shopping? And he did. So I tell you what, I had one of his nurses with me. His driver took me and my sister and my brother-in-law. We went to the market there and got to experience that, and it was nice. I mean, everybody was friendly. I never felt violated, or I never felt uncomfortable even. I never felt like I was going to be cornered and robbed or anything. I mean, it's like a family-oriented town. I mean, it's not bad at all.
And the prices for food are great.
Well, I didn't get to figure that out, I was straight liquid 30 days pre-op. Yeah. And then, of course, liquid after.
The whole experience, though, I mean, you felt that from start to finish, it was what you wanted to achieve.
Absolutely. And everything went as I was told it would go. How many times does that happen? I was just thinking about last year, I had a tonsillectomy here at the local hospital. And nothing went as it was supposed to go. But everything that Susan and Dr. Alvarez said is exactly how it went to the T. And it was awesome. Nothing happens like that. And, it takes a team to work like that. And that's what happened. I mean, it just flowed.
One of the things that really impresses me about Dr. Alvarez and his team is the amount of information that he puts out there for individuals to see, to hear, to experience. And no American doctors do that.
Absolutely. My PCP recommended him, and that was his words to me, was that if our United States doctors gave the information and did what they were supposed to do like he does, maybe, the U.S. doctors would be as successful as what he is. But doctors here, now my ear, nose, and throat doctor is very good, but most doctors here are just very nonchalant. They want their nurses to take care of everything. And the nurses don't know your detail, or, everybody's detail is different. They're just telling you off the top of their head what they think, But no, Dr. Alvarez is fully committed to making his patients very comfortable.
Well, we are running out of time. So if you have any last minute advice, if you could share that would be awesome.
Well, I really don't know. there's just so much I could say. I tell Susan all the time, I could talk about this for days. But I don't know, just drink your water, stay hydrated, eat a lot of protein. Love Dr. Alvarez. I mean, it is what it is.
Well, thank you, Brandi. And